Hey there, it's time to take the lead. Trust your voice, know what you need. Let's break it down.
Welcome to Beyond Clinical Walls with your host, Dr. Bayo.
We'll claim your life.
You brush your own teeth twice a day, you floss, maybe not as often as you should, and you see your dentist twice a year. But when it comes to your kids, that's where things get confusing. When are you supposed to start brushing? What kind of toothbrush do you use on a baby? And how on earth do you get a toddler to cooperate? Your child's oral health journey starts way earlier than you think. We're talking about pregnancy, and those early habits you build, they matter more than most parents realize. If you're new here, welcome. I'm Dr. Bayo. I'm a family medicine physician, a mom to two girls who are 9 and 11, and I spend my days in the clinic, on the news, traveling around the country speaking, and right here on this podcast, helping you understand your health and how to navigate the healthcare system so you can better advocate for the care you and your child deserve. Today's guest is Dr. Ashley Lerman. She's a Board Certified Pediatric Dentist, the founder and CEO of Firstgrin, and a mom of two under 3. So she gets it from both sides, the clinical expertise and the reality of trying to brush a squirming toddler's teeth. You might know her from social media. Dr. Lerman, thank you for being here.
Thank you so much for having me. I love everything that you do, and I'm excited for the conversation today.
I am so excited to have you on the show. Okay, if you're game, I like to start with a little rapid fire questions, if that works.
Always. Let's do it.
Okay, we'll get into the hard stuff first. What made you decide to become a dentist?
So I get asked this one a lot. Both my parents are dentists, and I grew up helping around the office, helping answer phones. And I remember when I didn't have a babysitter, I'd be in the back room and my dad would blow up a glove and I would be there just kind of like tapping it until they were done with work. So just fully exposed and grew up around it.
Love it. What's one oral health myth about kids that drives you absolutely crazy?
Something we hear all the time is that baby teeth don't matter, but we know data supports that cavities in the baby teeth are correlated with cavities in the adult teeth. So we really want to shift that narrative and, make people understand on a practical level what they can be doing at home to make it better.
If you could get every new parent to do just one thing for their child's oral health, what would it be?
It would be, believe it or not, to start brushing as soon as that first tooth is in the mouth. A lot of people don't realize that.
There's so much myth around it, and that's why I'm so glad that we are having this conversation. What's something about your own kids that has completely changed how you approach pediatric dentistry?
Understanding the behaviors around it. My older is 2.5 and I have a younger 14-month-old. So seeing when they don't want to brush, the negotiating, the tantrums, all of that, and understanding as a parent, kind of reframing it as a non-negotiable, similar to a diaper change, going into the car seat. So we don't really negotiate around health or safety, those types of things.
I love how you said negotiations because I think you just spoke to every parent listening. Negotiations are a part of our fabric. And I love that we get to talk about dental health and how challenging it can be. So let's start from the beginning. I sometimes get questions from parents in my clinic about how to start caring for their baby's teeth. So walk us through this. When does oral care actually begin? And what should parents be doing before that first tooth even appears?
Something that you mentioned earlier is that oral health for kids actually starts during pregnancy for the parent. We know that maternal oral health is correlated with childhood oral health. So a mom's oral health status is going to influence her babies. So we want the parents to really take care of their own oral health first. The second is once baby's born, you can start wiping the gums ideally once a day. That's to get into the routine, help the baby desensitize. And then as soon as that first tooth comes in, according to AAPD and AAP, you want to start brushing with a rice or smear amount of fluoride toothpaste and a soft bristle toothbrush.
Okay, so the tooth comes in, it's popped up. What does brushing look like for that one tooth?
So I think people get bogged down with this idea of 2 minutes per day. You don't need to be brushing a single tooth for 2 minutes. You just want to get all surfaces of it. Even if that takes less than 1 second, a really good brush. And then ideally at nighttime, nothing to eat or drink after. So one of our main things is not sleeping with a bottle of milk, a bottle of juice.
We started this conversation off with negotiation. So we now know what we're supposed to do. We've got that one tooth that popped up. And even before that tooth popped up, we know that we're going to be wiping the gums. So how do you even navigate this with, I correlate it to a wrestling match with
That's
the
exactly
brush.
right.
Yes, and you've got your child and you've got yourself. You're trying to handle
Yes.
your emotions. So I say that intentionally. How do we go through that? How do we wrestle ourselves with our children? How do we make it happen?
Totally. And I parallel it to like Crocodile Dundee. Like that is the visual that it is. Earlier on, when babies are less mobile, it's easier and you want to get them used to that feeling. Toddlerhood can be challenging because they're moving around, they're flipping over. So positioning is so key. I always tell parents or caregivers having like a backboard is really helpful. So whether your child's laying on the bed, a changing table, the high table, and then sometimes you can actually put them underneath you with their head in your lap and your legs over their arms so they don't grab the toothbrush, because that's what we see all the time. When you have control over it, you'll be able to brush efficiently, and then you can give them a turn after to give them some agency, some independence, and like authority in it too.
So I love that you said, really positioning is key. And I know in my clinic, whenever we're going to give medicine or a vaccine or some sort of intervention, sometimes you are having to stabilize just to make sure that you don't inadvertently hurt your child. But I think people forget that even though they've seen that in a doctor's office, that applies, of course, in a doctor's office when you're at the dentist or when you're at home. And so that's going to be really practical to help that parent be able to help their child navigate the toothbrush and just being able to provide this role play of oral care. And I say that intentionally because once they start to get that down, they can understand as they get older what's supposed to happen so they can have those strong habits. What advice would you give to that parent when they're gearing up, they're getting ready for their child's first appointment?
Having a script and getting ready, similar to what you said, talking to your child before, watching a YouTube video, going through a book. I think visuals and scripts can make children feel more comfortable and know what to expect. And I think a big part of it is managing our own expectations as parents too, because I've had a lot of patients come in where parents have had anxiety or poor dental experiences and they're really nervous and they project it unintentionally. Kids can pick up on that really quickly. So understanding that everyone in the operatory, so parent, dentist, and child, are on a team, and everyone wants a positive experience with that.
When should a parent schedule their first dental visit for their baby?
So the recommendations say by age 1 or 6 months within the first tooth coming in.
Okay, so now we know when we're supposed to go into the office. Now, what things can parents do to protect their child's teeth even before that appointment?
So we want to make sure we're ideally brushing twice a day, morning and night. After nighttime brushing, nothing to eat or drink except water, ideally. As soon as two teeth touch, you want to introduce flossing. That's something that's really overlooked and really, really impactful down the line. And then the last is nutrition. We know that increased snacking frequency is increased cavity risk. So if you're snacking all day, it actually increases your cavity risk. So you want to organize meals and ideally drink water in between to give the teeth a break.
So I'm so glad you brought up snacking. I think every parent, that word is a common word that we hear in our household. And
Ours
such as
too.
yes, when I would pick up my kiddos still from school or even the daycare, it was, what snack do you have, mommy? And so I love how you talk about not only just brushing is essential, but also snacks and which snacks you choose. And we'll get into that a little bit later. So here's a reality check. A new systematic review in BMC Oral Health found that children who start brushing by age 1 and brush at least twice a day have significantly lower odds of early childhood caries. Now, children brushing less than twice a day had over 2 times higher risk of cavities in their preschool years. Dr. Lerman, age 1 seems so early for some parents. So help us understand why this timing matters so much and what happens if we wait too long to start these habits.
Yeah, I think something that we discussed a little bit is baby teeth are often overlooked. People don't really know when they're falling out, but they're in the mouth for quite a long time. The last baby tooth tends to fall out by age 13. So think about that timeline. They're introduced to milk, snacking, maybe not as great brushing and habits at home. So the earlier that we instill those habits, the earlier we can protect them and ensure a longer lifespan of them. And again, there is this period in the mouth where there's a mix of baby teeth and adult teeth. So if you have baby teeth with cavities, that bad bacteria can actually spread to the adult teeth and affect the adult teeth as well. So you really want to have a good foundation for those adult teeth to come into, which is around age 6 for kids.
I love how you mentioned that because often people, and I said this earlier in the show, that it's thought, well, it's baby teeth, they're going to lose it. There's no impact. But just as you just mentioned, the caries, the bacteria that can spread to the adult teeth. That's so important for people to know.
Super important. There was also this huge study recently from the International Journal of Cardiology, Heart and Vascular, and it studied 560,000 people, and it showed that inflammation and poor childhood oral health is associated with increased cardiovascular risk in adults. So it's really starting early, thinking about the whole body care starting in childhood, which I'm so passionate about. Again, we're glad we're having this conversation for that.
Well, we also talked about, the nutritional habits, what you can do to set the foundation now as they get older. And we also talked about snacks. So let's dig into that.
Yes.
What are some options that parents can choose? And what do you choose for your kiddos as far as, being a mom of 3 little ones?
I never like demonizing anything because as parents, we're just trying to make by. Sometimes we choose things out of convenience, and I'm totally, totally sensitive to that. So in terms of tooth healthy snacks, things like cheese, seaweed snacks, nuts, meats, things that aren't necessarily processed, those tend to be better choices. That includes raw fruit, raw veggies. When it comes to things that can be damaging to the teeth, obviously candies, gummies, soda. But things that are often overlooked are things like crackers, chips, pretzels, things that are salty. Puffs are a really popular one. The reason is because they stick in the teeth and they stay there for a long time, and they break down into that cavity causing fuel, essentially. And to be honest, I still have those things in my cabinets. I'm still giving them to my kids. What I want parents and families to be aware of is just the frequency at which they're eating them and making sure they don't sit in the teeth for long periods of time. And that could be drinking water after, giving a piece of celery or carrot after to help flush the teeth. But again, everything being realistic and not demonizing choices for parents is what I'm all about.
That's really helpful because there's a lot of there's a lot of confusion when it comes to just trying to make it through as a parent.
Yes.
What do you choose? What
Yes.
don't you choose? What's the new guideline? And you mentioned something about certain things that are often overlooked. And I think juice is also a big one where I'll just give an example. In my clinic, I'll have a kiddo come in and they haven't been feeling well. Let's just say they've been vomiting, they have diarrhea, and this parent is trying to do whatever they can to make sure that they have some sort of nutrition. And in our world, it's like, as long as they're staying hydrated, that's all that I'm that's the one thing I'm hoping for, like staying hydrated versus food. But it's
course.
also about what you choose to hydrate your child. And so in my world, juice can sometimes have a lot of sugar and it can actually make diarrhea worse. I'd love your thoughts on juice when it comes to oral health.
Yeah, I think you hit the nail on the head. I'm glad you brought it up because it is full of sugar. And when it comes to the teeth, sugar breaks down into acid into the mouth, and that's what can cause cavities. So if we're drinking juice through the day, causes an acidic environment and can increase cavity risk. So you want to treat it like a snack, similar to a puff. If you are having it, having some water after to flush the mouth actually helps a lot when it comes to teeth.
Okay, let's talk about something that it's in the news and there's a lot of confusion around it. So let's dig into it. Fluoride. Because there's so much misinformation that's been circulating. Parents tell me they're not sure, what to believe. And I'd love for you to kind of cut through that noise and share with parents listening right now. What do they need to know about fluoride for their kids?
So, such a hot topic right now. Fluoride's one of the best, most studied and effective ways to protect the teeth, especially for children, especially when it comes to health equity. So, that's what I always like to start with. Highly recommend it for all kids across the board. It does come in 2 different ways that we take it. So, systemic in water, so chewables or drops, versus in toothpaste. So, and they help in different ways. So, drops and chewables will be helping the teeth that are developing, whereas toothpaste is going to help the teeth in the mouth. So they actually complement each other. It's not really one or the other situation.
That's really good to hear because you just hear about fluoride in itself, but you don't hear about the different options that are available and how it can make a difference. And I love that you mentioned health equity because when it comes to public health measures, that is something that it isn't talked about. Now let's move to pacifiers and thumb sucking. My youngest was a huge thumb sucker, and it was to the point where I had to choose my battles on when she was going to just allow to keep sucking her thumb. And a lot of parents worry about this. When do I intervene? And When could this be a problem down the road? What's your approach to handling these types of habits?
So I'm for sure a choose your battles girl. Both my kids loved pacifiers and we used it because it helped us with sleep. So I say with parents, every family knows best. But when it comes to teeth, you ideally want to wean by age 3, which is on the later side, to be honest, because we tend to see dental effects at that point. Ideally, by 18 months, we want to see people weaned by pediatric dental standards.
Would you say around 18 months, that would be the time to go into your dentist, talk about it?
Yeah, I think you can talk about it at that age. When it comes to thumb sucking in particular, maybe a little more challenging because it's attached to the body, and kids tend to wean off when they're emotionally ready. We found that more so in the pediatric dental world. With pacifiers, there is more of a direct solution where you can either cut cold turkey or take it away, things like that.
But again, each family, it's an individual choice. But if you have already started that relationship with your dentist, what a great way to be able to follow along and then decide what might work best for you. Earlier in the show, we talked about rules and habits and how your child can feed off of your habits. And so I'm going to get a little personal for me. I have a lot of anxiety when it comes to the dentist. I've always had it. And when I had children, I was very intentional of not wanting to pass it along to them. And so, I've tried my best to make sure that they go to the dentist often and not rub off my concerns to them. What are your thoughts with that? What could someone who is listening right now, who is a parent or expecting mom, and they're like, I'm struggling. How do I help my child when I can barely help myself get to the dentist?
Oh my gosh. And I give you so much credit for saying that because I think the first step is just being honest with yourself and realizing that and realizing you want to have, your child have a good experience down the line, right? Talking to your provider about it. We hear that all the time from parents, and we want to make the parent just as comfortable as the child. Even resources online, YouTube videos, reading about it, exposure, desensitizing, things like that are really helpful. But I think the awareness is really, really key. And then being intentional about being vocal. Like the dentist is here to help us. Sometimes we can hear parents kind of threaten their child thinking that it's going to make them behave more, like, oh, if you don't behave, you're going to get shots or you're going to get teeth pulled. And that can have a rebound effect and the opposite effect and scare a child more. So being aware of how we're talking about it in front of our kids has a really, really big effect on them and ourselves.
Yes, language matters. And,
Yes.
in those impressionable ages, they're taking in everything. We often say they're sponges, right? Well,
Yes.
they're also going to soak up that negativity or a word association, which can affect them down the road. So
Yes.
earlier on, we touched on oral health and how it connects to overall health, but I'd love to dig a little bit deeper into that. Can you help parents understand why their child's dentist and pediatrician should be talking to each other and what coordination means for that? Because in healthcare, it could be difficult because it feels like no one's really talking to each other, which feels the opposite of what should be happening.
Yeah, it can feel so siloed. And I'll say, as a dentist, we always want to know the extent of the medical history, whether that's behavioral, whatever medications they're on, because it can affect how we treat children. For example, autism, behavioral needs, sensory needs. We want to make sure kids are comfortable in the chair. There are a lot of new sounds, smells, sights, all of these things. And those are considerations we want to take in. And that goes into cardiac history, surgical history. All of that goes into our note as well and is a part of a safe way of treating a child and their family.
I have some friends who are dentists, and I often, highlight the fact that dental health is health. Like people don't put those two things together. We are treating the whole body, and that includes your gums, your teeth. Everything connects together. This takes me to I know you created Firstgrin to help parents be able to have tools and guidance towards how do they navigate their dentistry care for their kids. And it's important that I mention that this episode is not sponsored. I just really love what you're doing. So, can you tell parents a little bit more about Firstgrid?
So I created Firstgrin when I was sick and tired of seeing so many cavities in young kids. My first job out of residency, I was seeing 80 to 100 patients a day, 3-year-olds coming in with mouths full of cavities and really confused and lost parents. So I decided to take a step back and create a platform essentially revolving around education, resources, and products that are sent directly to families at different stages of life during pregnancy, during infancy, during toddlerhood, and beyond. So we're sending you, again, what to use, how to use it, and when, with app, with the support. So if you need to call a licensed dentist, all going through your insurance, and really putting up guardrails in a way that doesn't exist. And I feel really, really proud of it. I love working alongside my physicians, my counterparts, my other dentists to build this ecosystem in a way that I know is helping parents. And social media is a really big part of that. Awareness is a big part of that. So thank you for what you're doing too, because it really helps all the pieces come together in the puzzle.
You are doing a fantastic job, and I love the tools and the guides, everything that you're putting out there on social media and helping people. Dr. Lerman, I know you're offering something special for our listeners who want that extra support at home. Can you share what that is?
Yes. So everyone listening can get a free year of the Oral Care Companion app and 50% off all oral care kits with code HALFBRIGHT50. And the app helps track habits, unlock rewards to free product, makes daily care achievable and fun. And like I said, you win points towards free product and can connect to care too.
Thank you so much for sharing that with the listeners. I love that. Before we wrap up, give us 3 things that parents can do this week to set their kids up for healthy teeth and gums, whether you have a baby, a toddler, or a school-age child.
I'm all about progress over perfection, so these are my 3 main ones. Lock in a nightly brushing routine, so even if you can't swing morning brushing, aim for that night brush, nothing to eat or drink after. Second is schedule your preventive dental visits for everyone in the family. And the third is make water a default option for drinking at home for everyone too. It'll make it easier if you keep it out on the counter, make it visible, and then offer water after snacks and meals.
I love that. Let's keep water on the counter. That's like you could put it in a pitcher, you could just put it there, and it's a lovely go-to versus grabbing something else. Great, great tip. Dr. Lerman, thank you for breaking this down in such a practical way. You've given parents clear steps they can take right now, answered their questions that I hear all the time, and helped us understand how to raise kids who don't grow up with dental anxiety, like so many of us have carried, including myself. So I am so grateful to have had you as a guest on today's show. Any parting words?
Just want to thank you for everything you do for resources for families, for patients, for individuals like me to learn more and really understand through conversations like this. So thank you.
Well, thank you. For those who want to learn more about Dr. Lerman and take advantage of that special offer, you can find her and Firstgrin all over social media. We will have all of the links in our show notes. Dr. Lerman, thank you again for joining me. Did something in this episode change how you think about your child's oral health? Maybe you didn't realize brushing should start by age 1, or you learned how to make dental visits less scary, or you finally answered why those daily habits matter so much. Share this episode with another parent who might need to hear it. The habits you build today can give your child a lifetime of healthy smiles. You've got this.
Thank you so much. That was amazing. Thank
It
you.
was
Thank you.
wonderful. Thanks for listening to Beyond Clinical Walls. If you learned something new today, please leave us a review on Apple Podcasts or Spotify. It really helps us reach more people who could benefit from these insights too. Hit subscribe so you never miss an episode. We've got amazing content coming, including great episodes with the health creators you love.
You've heard the truth, now take the lead. Stand for yourself, know what you need. One step closer, you've made your mark. Keep showing up and light the spark.